Hi, my name is Carrie. Today I'm going to be demonstrating the Heimlich maneuver. Imagine you are sitting in a crowded restaurant with your friends. Your friend takes a bite of food and suddenly puts the fork down. A look of fear and then panic comes across their face. They begin to beat at their chest and grab at their throat. What is happening, and how can you help your friend? Unfortunately, choking episodes like this happen far too frequently. I'm here to equip you and give you the knowledge on how to save somebody using a simple maneuver called the Heimlich. I have been a nurse for 25 years. During this time, I have seen the Heimlich maneuver used effectively in every episode that I've been witness to and have helped with in saving somebody that is choking. According to the National Safety Council, choking is the fourth cause of unintentional injury causing death. This procedure can be done by one person with no equipment, and very little medical background knowledge is necessary. Today I would like to show you how you can save somebody's life that is choking. I will do this by going over signs and symptoms of choking, the difference between a partial obstruction and a complete obstruction, the procedural steps in the Heimlich maneuver, and what to do if you find yourself alone and choking, and how to improvise. Let's start off with signs and symptoms of choking. Some of the most common inaudible signs of choking is panic motions and grabbing of the throat and neck. It depends on what level of obstruction is going on to what you will do next. There's a partial obstruction and a complete obstruction. Knowing the difference between these two is very important because that is how effective you're going to be in engaging them and what steps you will take. With a partial blockage, there's going to be noisy or strained breathing. This type of breathing is known as stridor breathing. I would like to show you an example of stridor breathing.
In this look sound video, we're going to discuss stroke.
Also, with the partial obstruction, there still is going to be some air exchanging. This person most likely will be coughing. At this point, you want to encourage them to keep coughing so that they can hopefully bring up the obstruction themselves. At this point, with somebody with a partial obstruction, you never want to deliver back blows. Hitting somebody in the back can cause that obstruction to go further down into the trachea, therefore going into a complete obstruction. A complete obstruction or blockage is a true medical emergency. There's no air exchange happening. That person is going to not be able to speak or yell or cry out for help. They're going to be under extreme duress and show high levels of anxiety. Another thing that can happen is facial discoloration. This facial discoloration is because of the air has been shut off between the upper airway and the trachea. It can range from flushed skin to pale to cyanotic or blue. Usually cyanosis will start around the lips and spread into the facial skin. This is a very serious sign of a complete obstruction. And within seconds, that person will lose consciousness. Effectively, you have mere minutes to enact or engage a person who is choking. After 5 minutes of oxygen deprivation, brain cells are affected. That person can end up with brain damage and/or death. Now let's learn to save a life. The first thing you want to do is assess the scene. Is it safe? Are there any hazards around? If so, you're gonna wanna move that person and get them into an area that is going to be safe for not only them, but you as well. Then you're gonna assess the person. Is it a partial obstruction? Is it a complete obstruction? Lastly, you wanna gain consent. Now, this is usually done by simply stating your name, that you know how to do the Heimlich maneuver, and that you want to help them. That person does have a right to refuse assistance. Now, in all my years, I've never known anybody who is choking to refuse any assistance. If that does happen to you, I need you to call 911. Wait for EMS to arrive. Let them know that that person was choking, because at this point, ideally, they're probably on the floor unconscious and that they refused assistance. The Heimlich maneuver itself is abdominal thrusts or compressions. This creates an artificial cough. By pressing upward onto the diaphragm, you are causing air to be forced upwards. That force of air is enough to expel anything that is lodged or obstructed in the airway. The Heimlich is forceful, but will not cause any injuries to the ribs or internal organs. That is why it is imperative that you know proper hand placement before you start doing the thrusts or the compressions. You want to go behind that person. John?
John, come
We,
on.
we need you to go up there for demonstration. He thought he was gonna get-
You want to stand behind the person, evenly distributing your weight so that you're steady. You're going to take both your arms and cross over at the waist. Your non-dominant hand, you're going to find the belly button. With your dominant hand, you're going to make a fist with thumb out and place that thumb side down above the non-dominant hand. Then you're going to take your non-dominant hand and cover your fist. I always like to think of rock, paper, scissors during this time, because paper will always cover rock. Then you're going to go in an inward and upward motion, 5 to 10 times each cycle. And I always encourage people to count out loud. During times of extreme anxiety, you can kind of forget your placement, but counting out loud will help you stay focused. 1, 2, 3, 4, 5. During that time, you're going to want to pay attention to that person. If they begin to cough, it's a sign that it's gone into a partial obstruction, and you will stop compressions and thrusts and just encourage them to keep coughing. Thank you. If a person is too big and or pregnant to get your hands around them, I'm going to need you to move your hand positioning upward. Your base is going to be at the base of the breastbone, right above the very last rib. And you will do the same style of compressions or thrusts, but it will be chest. Lastly, I want to discuss what you can do when you find yourself alone and choking, and how to improvise. First of all, I want you to call 911. If you're around a phone or have a phone by you. Nowadays, everybody keeps their cell phones pretty close. And I know it may sound silly to dial 911 if you can't speak or talk, but engaging the EMS system, they will enact and arrive. Even if you're not talking, just leave the phone on. Then I want you to find a firm surface, either a countertop, a table, or a back of a chair. You're going to take your hands and do the same positioning. Find your belly button, cover, place it upon the back of a chair, right onto the diaphragm, and then you're going to use the same inward and upward motions, doing it 5 to 10 times. That sums up the demonstration today on the Heimlich. Remember, the universal sign of choking is grabbing at the neck or throat. We have covered signs and symptoms of choking, the difference of a partial or complete obstruction, the steps or performing technique of the Heimlich procedure itself, and we have covered how to assist yourself if you find yourself choking and alone. The Heimlich maneuver will save the life of a choking individual. Thank you for joining me today. I hope you never find yourself having to use this maneuver, but if it does happen, you are now ready to deliver this life-saving technique. Thank you.
Awesome.